مولاي صل وسلم دائما أبدا على حبيبك خير الخلق.
Assalamu alaikum, everyone. Welcome to ICOI Health Committee's first webinar on coronavirus, Things We Should Know. Thank you so much for joining us today. My name is Manazza Ahmed, and I'm the chair of this health committee, and I'll be your host today. First of all, some quick gentle reminders so that everything goes smoothly here. Please put your microphone settings on mute and keep your cameras off to avoid any disruptions. If you have questions during the webinar, please type it in the chat box at the bottom. We will address the questions during our Q&A session at the end. If your question pertains to a particular speaker, then please write their name with your questions so we can direct it to them accordingly. So thank you so much in advance for keeping these in mind. So we started this health committee at ICOI with a vision to bring high quality and evidence-based health information to our community from reliable sources. Our first in-person seminar was back in August 2019 on Medicare, where our speaker was invited from HICAP and Council on Aging. Quite a few people benefited from that event. And today our speakers include specialists from diverse healthcare backgrounds and some government officials. Coronavirus is a rising concern among many communities, not only in the United States, but around the world. One day we have one information and the next day it's totally different. The information on symptoms and affected population is constantly changing. A plethora of true and false information is circulating in social media. There is a global lockdown going on, and the uncertainty is causing a lot of stress and frustration among many of us. In times like these, we thought that it would be important that we hear from the specialists on infectious diseases and ER from within our community who are facing it all firsthand. So without any further delay, let me please introduce our speakers to you. So today we have with us Dr. Sahir Khan. He is an assistant clinical professor of infectious diseases at University of Irvine, California. He'll be shedding light on causes and impact on COVID-19 pandemic and recommendations for general public. Welcome, Dr. Sahir. Welcome. Dr. Taliha Yasin is an infectious disease fellow at UCI. She will be presenting some statistics in California and Orange County in general, importance of social distancing, and how we are approaching it as a community. Welcome, Dr. Taliha Yasin.
Thank you.
And we also have Dr. Huma Khan, who is our board-certified ER physician at Anaheim Medical Center and Methodist Hospital of Southern California. She will be explaining what is actually going on inside the ER, what they expect, and what to do in particular circumstances. Also some challenges that are faced by ER doctors these days. Welcome, Dr. Huma Khan.
Thank you.
Mm-hmm. Last but never the least, we have Joy White with us. Joy has a Master of Science in Nursing and is a doctoral candidate at Duke University. Joy is an executive director at the U.S. Department of Veterans Affairs in Washington, D.C. Welcome, Joy White. So we will also have a special guest, Congresswoman of 45th District in California, Katie Porter, joining us later. She will be updating us on measures and bills being discussed at the Congress regarding COVID-19. So welcome, everyone. Thank you. I'm gonna go ahead and hand it over to Dr. Sahir. Over to you, Dr. Sahir Khan.
Thank you. So I'm gonna go through a quick slide deck here so as a background, I'm an infectious disease physician and I conduct research on respiratory viruses. So I'm gonna go through a little bit on what are we actually dealing with here. So So COVID-19, where are we now and where do we go from here? And so a little bit on terminology. COVID-19 is the name of the disease and SARS-CoV-2 is the name of the virus that causes the disease. This virus is closely related to viruses originally found in bats, similar to the original SARS virus of 15 years ago. And the way the virus infects us is it binds to a receptor on cells lining initially the nasal passages, but eventually lining the lungs, causing severe disease in some patients. So these numbers are changing every day. So I think that the current estimates is we have over 100,000 cases in the US. These numbers on the slide are from just a few days ago, and over 600,000 worldwide. And the number of cases identified to date is likely a significant underestimate because we have not yet implemented widespread testing in most countries. And the US is just now getting started with widespread testing, but it's likely this virus was spreading significantly before we were able to implement a large number of tests. And the cases of community spread that are identified in most countries and most states likely indicate a large number of undiagnosed cases. And what community spread means is that when you cannot trace the virus to a particular initial case, somebody pops up with a virus infection and you don't know who they got it from. And researchers have analyzed these cases and found that when you start seeing cases pop up in the community, that indicates there's a large number of people that are likely undiagnosed that are walking around the community with the virus. So, the cases we've identified likely indicate that there's a lot more people that are walking around with the virus that don't even know that they have it. And so this map is a bit out of date, but what you can see though is that pretty much all over the world, this virus is present. And now the United States actually has more cases than any other country in the world. And many of the countries where you don't see cases, it's because they really haven't started testing, or at least at the time of this map, hadn't started testing yet. Every country that has started testing for this virus has found it in their community at this point. So a little bit on the mortality. So you hear the numbers 2 to 3% quoted as a worldwide mortality rate. And that is true strictly based on the cases we've identified by testing and the number of those cases where people have died. Now, it's likely that the true number is significantly lower than this. And the reason is that we're only testing the people who are sick. And we know that there's a significant number of people who have very mild illness who never get tested. And those people tend to recover and are not counted in our estimate of mortality. So countries that have done more widespread testing of more minimally symptomatic cases have found lower mortality rates. South Korea initially reported a study around 0.6%. These numbers vary, but just know that the reported mortality rates, it's likely that if we were able to test everyone, it would be a little bit lower. So, but by comparison, seasonal flu has a mortality rate of 0.1%. Now in flu, we have large scale surveillance studies and testing, but it's very likely that this mortality rate of this virus, even if we were to catch everyone, would be significantly worse than the seasonal flu. And the mortality is heavily skewed to people with advanced age and medical comorbidities. So on this slide, I just show the mortality rate on the left, and this is from the Chinese version of the CDC. They presented a lot of data on the initial outbreak in China, and you can see the death rates on the left. When you get above 50, they start to increase significantly from this virus. And health conditions, if you have any of these health conditions, hypertension, heart disease, lung disease, diabetes, hypertension, high blood pressure, we're finding that a lot of these what we call comorbidities or other medical conditions can significantly increase your risk of dying from this virus. And then being male is slightly higher risk than being female. They think that in the initial study, this was because males tend to smoke more than females. So smoking is a risk factor for dying from this virus. And on the right, I just show a graph that essentially shows that the countries that have tested more people tend to have lower estimates of mortality because they're catching the mild cases. So the estimates of mortality in many of these other countries that have not really, at the time of this, had not really tested very many people are higher. But they're missing a lot of people that have milder disease. So contagiousness, each person with the disease will infect 2.3 other people on average. And this is actually less contagious than some other diseases, TB, measles, and chickenpox. It's similar to the common cold and more contagious than the seasonal flu. And all of the social distancing that we're doing is trying to reduce this number, trying to reduce the number of people that are infected by each case. And so, this is a very busy slide, but I'll just show, here, this little dot is where COVID-19 is. And you can see it's more contagious. As you go to the right, it gets more contagious. As you go up, it gets more deadly. It's more contagious and deadly than seasonal flu, but it's actually similar to the Spanish flu. It's a little less deadly than that. So, just to put it in perspective of where it is, the Spanish flu was a 1918 pandemic that happened of a earlier type of flu virus. So, just to put it in perspective of these other diseases that have been with us. So what do we need to do? So, epidemiologists estimate that 40-70% of this country will eventually get this. I think, it's important to slow the spread. And the reason is we don't want to overwhelm our healthcare system by everybody getting sick at the same time. So this graph on the right essentially shows that, if you're able to slow the spread, you can maintain the level of disease below what will overwhelm our healthcare system. And so that's our goal. It's probably too late to say stop the disease in its track, but we can slow it down so as not to overwhelm our healthcare system. So if you're under 50 and healthy, you really just want, your main goal is not to spread the disease to others. Most people under 50 and healthy, you'll hear about cases of people who do poorly, but by and large, most people do relatively well. But your parents, other people you work with or friends who are less healthy, these young healthy people are the carriers that infect others. And many of the patients who are older 50 and have chronic medical problems, those are the people who really we worry about as having a propensity for very severe disease. And so to avoid catching the disease yourself or spreading to others, and this has been out there in the media, but avoiding handshakes, personal contact, avoiding touching surfaces as much as possible, and wipe them down frequently. Avoid touching, insides of your mouth, nose, and eyes, especially if you haven't washed your hands, and wash with soap and water, 20 seconds, use hand sanitizer. If you're over 50 or have chronic medical problems, and actually this goes for everyone now, just avoid going out in public as much as possible, particularly crowded areas, airports, minimize contact with others at home, especially if they're sick. And, I actually, in order to conserve supplies for people who are sick, the recommendation are not to wear a mask if you are healthy. Now, given community spread, anyone with a fever and respiratory symptoms is a potential case of COVID-19. Before, we used to think only if you traveled to a country with high risk, but now it's in our community. Anyone could have this. And most patients who have fever, respiratory symptoms should self-quarantine at home. I'll talk about that in a second, until the fever has been gone for more than 1 day. And actually, CDC is now recommending more than 3 days for most people. If you have shortness of breath or feel faint or have a fever that persists, you should call your doctor, particularly if you're over 50 or have chronic heart or lung problems. If you need to go to an emergency room or a clinic, please call ahead and make sure to tell them, hey, I'm coming and I have these symptoms, so that they can appropriately direct you to, get masked and protect the healthcare workers and protect the other patients who may be in the waiting room. And so these are two types of masks. There's surgical mask and then a respiratory mask, which it completely filters the air. And so anyone who has fever, respiratory symptoms should stay home, wear a mask around other household members, separate bedroom, bathroom, avoid sharing food, especially avoid anyone over 50 or chronic heart and lung problems. I know in this time we want to all come together as a family and see each other, but I recommend to my friends, don't go see your parents right now, especially if you have any symptoms, because you want to really try to protect them. And if you have to go out in public, wear a surgical mask for coughing and sneezing. Supportive care for this virus basically means drinking fluids and resting. There's been a lot of talk about drugs like Plaquenil, hydroxychloroquine. There is no evidence that any of these drugs, either preventatively or even as a treatment, actually work. We're doing a lot of this as experimental treatments. And so household members, if you develop fever, respiratory symptoms, immediately self-quarantine. Or if someone you've had close contact with is a case, immediately self-quarantine. And then in the hospital, and I think our emergency room physician can probably talk a little bit more of this, but inform ahead of time that you're coming and you have these symptoms. Once you get there, they should put a mask on you if you have these symptoms. You should probably be tested first for influenza, other respiratory viruses. We don't want to miss something else that you have because you come in as a potential COVID case. And our testing is expanding, but right now we're still reserving the test for people with significant symptoms and high risk of disease. And so our testing right now is delayed. It takes about a week for most tests. We do have some on site at UC Irvine, but we are working on rapidly expanding that. And we hope that in the next few days to a week, our testing capacity will improve. So thank you very much. That concludes my presentation. I'll be around to answer questions that anyone has.
Thank you so much, Dr. Sahir, for sharing your expertise with us. Those were some really good insights on the severity of the COVID-19. And I'm sure we'll have a lot of questions on this later on. So now we are moving on. And Dr. Taliha Yasin, you're next, please.
Thank you so much for having me. I'm Dr. Taliha Yasin. I'm a UCI Infectious Disease Fellow, and I'm going to be talking a little bit about the statistics and kind of prevention methods for COVID-19, and then some of the local cases and the numbers in Orange County and Los Angeles. So currently, the total cases worldwide are at around 530,000. You know, China had more than 80,000 cases, but that was slowly discovered, and 80,000 was around their peak. The USA, unfortunately, as Dr. Sahir Khan mentioned, surpassed the rest of the world with 85,377 cases reported yesterday, and that's largely due to the increased amount of testing that we've been having. So, and kind of the way that China got there, on January 22nd, they had around 575 cases. By February 19th, they were at 74,000, and then they peaked at around 80,000, and that's where they stayed. So for us in the United States, we had 15 cases as of February 15th. A month later, we had 13,800 on March 19th, and then just 10 days later, you know, we see the surge of over 85,000. And this is kind of the worldwide distribution. You can see we're at the very top, followed by China, Italy, Spain, and Germany. And the highest death rate is Italy at this time, unfortunately. And so the total cases in California as of yesterday, this data is rapidly changing, and I think it's around like 4,600 right now, but this was 4,002 cases yesterday in California. 826 of those cases were known to be community acquired cases, which means that there's really you know, no evidence or how that person got it. There's no relation to travel or any other positive cases. And the majority still were through person to person or through travel or, you know, our cruise ship passengers that we had. The age of our positive cases, the vast majority between 18 to 49 years, and around 1,500 cases, followed by the rest over 50. And then the gender, slightly more males to females, around 1,600 males and females, 1,300. And so this was yesterday in Orange County, 256 cases with 1 death. And then the male population was greater than the female with 152. And then this is today. So just within a day, we have a significant rise with 71 cases reported today. So 321 with 3 deaths, 2 of them being today. And then, so some of the main areas are basically Anaheim. There's 28 cases. And then, sorry, let me just make sure I'm sharing my screen. Hold on just a moment.
It's the green button at the, oh, perfect.
Can everyone see these slides? Just a moment.
Now we can.
Okay. Okay, perfect. Okay, just making sure. And so, yeah, the cumulative number of cases, 321, and 28 of those in Anaheim, 33 in Irvine, and 22 in Orange. So, and this is in Los Angeles. So we had 1,216 total cases with 21 deaths, and you can kind of read about the distribution right there. And so as far as the number of deaths from COVID-19 in California, previously, I mean, this is data from probably a day ago. So 67 people, 17 men, 10 women, and 40 of them still without gender disclosed. 18 of them were over the age of 70 and 5 in their 60s. And then at least 31 had underlying comorbid conditions. And so over here, is basically it's kind of a pretty neat map, which shows how, the epicenter was Wuhan, China, and it kind of shows how this turned into a pandemic with worldwide spread and, on almost every continent now. And so on March 11th, SARS-CoV-2, which is the virus that causes COVID-19, was declared a pandemic by the World Health Organization. And that just basically means that it was, a disease that had the ability to, cause this virus. And it had this international spread it had a global spread. And that's kind of, at that point when this was discovered, the World Health Organization, they tried to implement measures, and at that point, containment strategies were basically the next step, because when prevention and treatment are kind of two different things. So if we're able to prevent it, then like Dr. Han showed you this slide of kind of flattening the curve, what that basically means is preventing overwhelming of the health system. And as we can see, some of this was very successful in China. So they implemented this January 21st, where they started, a mass lockdown. They had social distancing, and they went as far as everyone going out had to wear a mask. All of the non-essential businesses were closed. And then just in 2 weeks, on March 7th, they had a drop to double-digit figures of their number of cases. So we do see that that was successful. Here in California, as of March 19th, we're all aware, we have safer at home orders, and all essential businesses are to remain closed. And that's, supposed to be hopefully somewhat helpful in getting, this curve down we just saw. So it's the number of cases and the time since the first case. And here in the yellow, you see without protective measures, what could happen. And that's just the capacity of the healthcare system would be overwhelmed. So if you have a large number of surge, what we say, of cases within that amount of time, then the healthcare system is unable to meet that capacity and meet those demands. And unfortunately, the results of that could be pretty devastating. However, if we continue to do the social distancing and take the proper measures, which we should all be doing right now, then you see that kind of, flattens over time. You have less number of cases and they're spread out. And so we are kind of doing that now by avoiding mass gatherings, trying to stay 6 feet apart when we're out. And so basically, another study basically studied the aerosol properties of this and how long the virus can be viable. And it was found to be viable for up to 72 hours on plastics, 48 hours on stainless steel, and up to 4 hours on copper. And so based on a study in a research journal, the Journal of the American Medical Association, they studied 3 different confirmed COVID positive patients and collected samples from them for on 2 days, two separate days of the week. 2 of the patients, while symptomatic, had samples collected after routine cleaning, which were all negative. The 3rd patient had samples collected before routine cleaning, and they did find various positive sites, including toilets around the toilet, different area outlet fans in the door handle as well in the room. However, all of the air samples in that study, from that one study, were actually negative. So that goes to show you that disinfection is actually pretty helpful. And basically disinfection refers to the cleaning, just surface cleaning. It doesn't just cleaning a dirty surface or removing germs. That's not included in disinfection. That's actually, you have to be using an alcohol solution with at least 70% alcohol. You can use diluted household bleach, and the CDC website will actually also tell you a way to dilute household bleach and kind of make your own disinfectant. I know that's kind of been scarce to find recently. And so social distancing, I think this is something everyone is kind of practicing now. So we want to avoid group gatherings, any mass transit systems. The malls are closed, of course. Going to the gym, any unnecessary travel. And then even when you're out in the grocery store, only if it's absolutely necessary, try to limit your trips out there. Picking up medications, if you can do that through the drive-through. Of course, mosque services, you just follow whatever your local, masajids advise. And, we obviously are avoiding any travel at this time. And then it is safe to take a walk, of course. You can, clean, cook, read a book at home, all of those activities that don't involve exposing other people. And so we are limiting face masks to those who are sick. And there's actually, hand washing and hand hygiene is actually more important. And that's kind of what would actually prevent you from getting this and spreading it to others. Unless you're absolutely sick, then of course you should be wearing a mask. So here are some of the prevention measures that basically, we're kind of doing right now, and environmentals as well as community. So some of those I already discussed here. And hand hygiene, I'm sure everyone is practicing this. So you want to use up to 20 seconds is the kind of the magic number, where you wet your hands, clean them, obviously with running water. I'm sure everyone is aware of how to do that. So I'll skip to the respiratory etiquette. This is very important, even at home, with family members, not just outside. So if this is basically according to the CDC, you want to cover your mouth and nose with a tissue, of course, when sneezing, or you can sneeze into your elbow. If you use a tissue, you want to dispose that right away. Perform hand hygiene right afterwards and discard of any respiratory secretions. And if anyone is coughing at home, you want to make sure that you can pass on a mask to them. And if you're within 3 feet of someone who is coughing, you are at higher risk of transmission via droplet infections. And so one other thing that I really wanted to mention is this has, as a Muslim healthcare professional, this has had a huge impact on how we worship. And many Muslim countries around the world have actually, had adaptive measures. There's been a ban for Umrah pilgrimage currently, and a lot of countries have actually put a hold on prayers at mosques currently. And so, I mean, it's very devastating, and it's heartbreaking as a Muslim healthcare professional to see this happen. And of course, our places of worship are very important, and it's an activity everyone really finds comforting. But I think right now, as a healthcare professional, I think all of us can tell you that the measures we're taking are absolutely necessary. And, there's obviously, this is kind of a part of the prevention, and that's going to be key in preventing the overloading of our healthcare system. So there's other options here mentioned. You can obviously use online khutbah transmission, prayer at home, modified versions, until it's safer to do anything else. And of course, at the end of the day, I'd just like to end with this. Of course, it's always, nothing happens except for the will of Allah. So, inshallah, we can hope for the best and just all do our part in trying to, get over this pandemic currently. Thank you.
Thank you, Dr. Taliha Yasin, for sharing these important statistics with us. It really gives us a great insight into the prevalence and incidence rate of this pandemic. Now we are moving on to Dr. Huma Khan, and let's see what actually goes on inside the ER. Dr. Huma Khan, you're next.
Hi, everyone. Can you hear me? Am I on? Okay.
Mm-hmm.
Okay, so I don't have any slides to share, but I do want to talk about what we are seeing in the emergency room right now, what we expect to happen in the coming weeks, and when you should be concerned enough to come in, and what symptoms are not as concerning. So first, I would like to commend everyone. Thank you for staying indoors. We really are seeing a difference in the hospitals. In the emergency room, we're actually seeing a decrease in volume. we're seeing a decrease in the volume of minor cases, or what we call the less acute cases. So we're not seeing as many of the cuts and the sore throats and things like that. But what I can say is that we're actually seeing, interestingly, a lot more critical patients. And around this time of the year, that's not very common. We actually see a lot more of that during the winter time. So seeing that at this time of the year is a little suspicious. And some of our colleagues over in New Orleans and New York have been seeing the same things as well. I think one of the reasons that might be, anecdotally, is probably because COVID-19 is co-infecting with influenza and pneumonia. Now, I don't want to scare everyone, but it is something to keep in the back of your mind, that there may be a co-infection. And right now, I don't think when patients are coming into the emergency room, if we see an influenza positive or if we see a pneumonia and we admit that patient, we tend not to test for COVID-19, but with all of these other cases popping up in the other states, we might start doing that. What we expect to see in the upcoming next, probably about 2 weeks, is a big surge. We're lagging behind a little bit with New York. New York has the highest number of cases right now. I think it's close to 30,000. And New Jersey is second, and we are third, so in California. So we are starting to see a high number. I think that social distancing and staying indoors, that may flatten the curve, and hopefully our predictions will be wrong, but we do have to prepare for the worst. So right now, we do, in the hospitals I'm at, in the community hospitals, we actually do have a good amount of supplies, and we have very generous donors coming in as well and donating masks to us. In the front lines, in the emergency room, it is very unpredictable. So we don't know what's coming, and we don't know if a lot of the patients we're getting right now are patients with psychiatric illnesses or with drug addicts or alcoholics, and they're not the best historians, so they can't tell us if they are coughing, because they're usually too intoxicated. So when they cough in your face, and you're having this moment where you're scared, because not every patient, we're not able to use the proper equipment for every patient. So right now, the surgical masks, which are okay for the general community, are not okay for the emergency room and for the critical care doctors or the internists seeing these patients that are COVID positive. So if you do have any resources for N95 masks, for suits, for masks, for face shields, please do direct them towards our community hospitals. Now I'd like to talk about when should you come to the emergency room. So we have quite a few families who actually come in. I would not recommend coming in as a family. We are not allowing visitors in the emergency room. It's very sad, because a lot of the patients who are unwell are older, and their spouses are older. So when they come in and their spouses are allowed to see them, that might be the last time they see them. So it's very hard for all of us. It's very hard for us to keep families out. But we do not recommend families come into the emergency room. If you do come in, some of the reasons to come in would be a fever in combination with shortness of breath. If you have a cough and a low-grade fever, and low-grade we mean under 100.4, then stay home, take some Tylenol, drink some fluids. If you happen to have respiratory problems, meaning difficulty breathing, then you need to, if you're having a lot of difficulty breathing, you need to come into the emergency room right away. But if you're not sure, you're saying, oh, I'm having a little difficulty breathing, I'm not quite sure, then you should call your doctor first and ask them their opinion. And I'd like everyone to write this down, this number, if you're not aware of it. It is 211. That is the public health department. They will direct you on where you can be tested if you are suspecting that you may have COVID-19, and whether you need to come to the emergency room. One of the things in the emergency room, I know Dr. Khan mentioned calling in beforehand, we're overwhelmed. We won't be able to take your calls. If you're calling us and you're telling us you can't breathe, you should be calling 911 and they should be bringing you in. But if you are able to breathe and you're able to drive in, we have tents set up outside of our emergency room. We will give you a mask outside, we will screen you, and then we will bring you in. So there's actually no need to call in ahead unless you are known to be, I guess the one exception might be that if you know you've been exposed to COVID-19 and you've been sent home, or a family member has been exposed and you've been sent home, then you can call us in and say you're coming and you know you have COVID-19. They could probably bypass that tent for you. So when to come in: fever in association with any respiratory problems such as difficulty breathing. If you are a healthcare worker, or if you are in contact with a healthcare worker and you have those symptoms, you also need to be tested. Now the guidelines are changing every day, sometimes every hour. We're told we're not allowed to test on certain people, then we're told the next hour we are. So right now the guidelines are that anyone in contact with a healthcare worker or someone who is COVID-19 positive with fever or lower respiratory problems, lower respiratory being difficulty breathing, you will be tested. If you're not serious though, you should try to go to a drive-up testing center or an urgent care or your primary doctor, because you will be less exposed. If you don't have it, you will be less exposed. The emergency room is not the right place to go due to exposure, possible exposure. And I can answer more questions about that, but please keep in mind the number 211 for the public health department. They can give you information about where to go to. Now, how do you know if your difficulty breathing is just anxiety or if you are actually having a lung problem? It's hard to tell. A lot of people who we are seeing who are having difficulty breathing right now, a lot of it is anxiety, and I understand that. We have a lot of anxiety as healthcare workers, frontline workers. I have kids at home. I have a mother-in-law at home. I realize I'm bringing things in possibly that could be exposing them. It makes it hard to sleep at night. I understand the anxiety. So actually one of the things that you can purchase, and I might have gotten the last one, I apologize, but I might have gotten the last one from Amazon, is one of these pulse oximetry devices. What you do is you put it on your finger, and hopefully mine is, oh, I didn't turn it on. And it gives you your pulse rate and your oxygenation. Hopefully mine is okay. Okay, it's not coming up, but I checked it earlier, it was okay. And you should be monitoring your temperature as well at home, especially if you're around healthcare workers. And I can answer more questions about that later. In terms of treatment for your fever, I know there's been a lot of controversy about ibuprofen, Motrin. For now, what I would say, there are no studies saying that, no definitive studies saying that Motrin, NSAIDs are Motrin, ibuprofen, all of those fall under NSAIDs, are implicated in worsening COVID-19 disease. However, there is one very small study that suggests maybe there is. So start off by treating your fever with Tylenol. If it's not improving with Tylenol you can take every 4 to 6 hours. If it's not improving with Tylenol, then maybe you do need to be evaluated. You need to call your doctor. You need to ask them, should I take Motrin? What should I do? Make sure you're drinking plenty of fluids. There's a common myth that elderberry might help. Please don't take that. That's not going to help. In fact, that might worsen your disease. If you have asthma, or if your child has asthma and they are getting sick, they have cough even, don't use a nebulizer treatment. A nebulizer treatment is a mask and it delivers medicine, and that medicine with the oxygen can cause droplets that spread. So you don't want to use the nebulizer. People who know what I'm talking about, they have an inhaler that has a chamber. You want to use that chamber or MDI, a metered inhaler. Onto a little bit more of a morbid topic. We do expect a surge. We do expect that people will be very critical. And a lot of those critical people will be elders, and they won't be able to make their own decisions. So this is a very hard topic to discuss, but I do encourage that you start making your wills and have an advance directive. Advance directive is what to do in case you are placed on a ventilator. And so your family doesn't have to make that decision for you. So they don't have to have the burden of deciding what to do with you if you already know that you don't want to be, to live on a ventilator. But it is something we come across in the emergency room, and we do have good resources. Let's see, what else can you do? One thing I did want to mention, you've been given a lot of advice already, and there's a lot of information, there's a lot of misinformation too, but there are a couple of things I do want to point out. Please wipe your phones. When you're coming in and out of the house, please wipe your phones immediately and wash your hands and keep a hand sanitizer coming in and out of your house. What kills the virus? Bleach actually alone may not kill the virus. So you have to make sure there's a 70% alcohol solution in there. UV light also kills the virus. If you are immunocompromised and you need to wear a mask, an N95 mask, do not clean it with alcohol because that kills the microfibers, or well, that destroys the microfibers that prevent the virus from coming in. So please don't use alcohol to wipe your masks down. And yes, I think that's all that I have for now, but if you guys have any questions, I'm here to answer them. Thank you.
Thank you, Dr. Huma, for sharing your experience inside the ER and giving us some very, very valuable information on how to take care. I hope everyone noted down the number 211. That is whether you need to come into the ER or not. I think it's very important. And thank you for sharing that with us. Now we are going to move on to Joy White. Joy White, you're on. Thank you.
All right. Good evening, everyone. Lots of information. You guys have received a ton of information. Hopefully you're finding this helpful. Give us some feedback in the chat. We want to make sure that we're bringing information to you that is absolutely useful. And I see that the chat is very active, and we are doing our best to answer your questions in real time. So we're going to talk a little bit about anxiety and how we manage stress during this time. A lot of folks are at home, and they're at home with loved ones and spouses, and things can be a bit stressful. And so I've got a couple of things that were not addressed, and I'm going to hold off on those, and we'll see if they come up in the Q&A. Because there are a couple things about food handling, or perhaps handling trash, disinfecting your home, laundry, pets. So if those are questions you have, let me know, or put them in the chat, and we'll be happy to respond to those. So we're going to talk a little bit about managing stress and anxiety during this time. Everyone reacts very, very differently to stress. Your reaction to stress and anxiety could be as a result of things that you've gone through in the past, your background, the community that you live in, but stress and anxiety is a real thing, and particularly during this time. We're talking about a pandemic. And so people who are more susceptible to stress are older adults, those with chronic diseases, our children and teenagers, and I'll talk a little bit about symptoms, signs and symptoms of anxiety next. People who are helping with the response to COVID-19. So our healthcare professionals, a lot of people forget about the executives who are having to make some of those decisions about where resources will be allocated. So it is a stressful time. Our first responders, people who already have pre-existing conditions can also be very, very stressed during this time. And we want to talk about that a little bit. So I'm getting some feedback that you all cannot see the slides. Will someone confirm verbally that you can see them? I want to make sure you can see them.
I'm seeing your main page.
Okay.
With
so
all the different files, so.
Okay, let's get out of there and make sure that you're seeing the right thing. So thank you.
No worries.
All right, let me know if you're
There
now
we
able
go.
to.
Perfect.
All right.
Thank you, Joy.
So let's talk about some signs of stress and anxiety. Ongoing fear or worry about your own health or the health of your loved ones. That's a big deal. Change in your sleep patterns. So you're not sleeping as well as you once were. Change in your eating habits. Either you're eating way too much or you're not eating enough. You have no appetite. Difficulty concentrating. Worsening of pre-existing health conditions. Increased use of alcohol, tobacco, prescription drugs, recreational drugs. For children, we also have to pay attention to the signs and symptoms of stress with our children. So excessive crying or whining, returning to behaviors like bedwetting that they had once outgrown. Not wanting to participate in activities that they've enjoyed in the past, and that's for adults and for children and teens. Unexplained headaches or body aches. Agitation, just a general feeling of being overwhelmed. Very real feelings. We are working from home. Our children, we have become teachers and we're teaching at home, we're working at home, we've got spouses at home. And so it can just be a stressful environment. So how do we manage in this environment? One of the things that I recommend strongly, and you'll see this everywhere you look, stop watching the news. Decide when you're gonna look at the news or your phone related to the pandemic, but you gotta get off, because repeatedly hearing these messages about the pandemic can become upsetting. So give yourself some breaks from that. Take care of your body, do some meditation, some deep breathing, eat healthy, exercise, avoid excessive alcohol, stay hydrated. You heard Dr. Khan talk about hydration, really important. Exercise. So I saw some questions in the chat about whether it's okay to go for a walk. Yes, it's okay to go for a walk. It's encouraged. Get out of the house and take in some fresh air. Unwind. So do some things that perhaps you haven't had time to do. While you are required, and we're asking everyone to honor social distancing, you can go for walks, boardwalks, puzzles, listen to music. If you journal or write, this is a wonderful time to do that. And then connect with others virtually. So you heard Dr. Khan say, you know, this is not the time to go and visit your parents. This is really a time to get on the phone and teach your parents how to use FaceTime. But we want to maintain social distancing, but it's really important to connect. So take the time to connect with folks that you love. Stay close to as close to a normal routine as you possibly can. So if you got up at 7 o'clock every day or 6 o'clock and you worked out and you got dressed for work, do the same thing. Go into your home office, but get up and get dressed. Try to maintain a schedule. Things can get chaotic at home, right? So try to keep things organized, because when things get disheveled, a lot of times that creates stress for us. One of the other things, and I thought this was really, really good, and this was from AMA, the American Medical Association, and they talked about losing the I'm stuck inside mentality and really starting to focus on, this is a time to focus on my family and myself mentality. Just changing the way we think about this time that we have. Also, be mindful again of your screen time. So while you may not be watching the coronavirus updates ongoing, make sure you're not spending all your time in the screen. So on your iPad or on your phone or on the computer, look up, walk away again, get up, get outside, read a book, break that monotony, create some new family traditions. And this is a great time for that, whether it's, you know, we have a daily game of Monopoly or Scrabble or Word Find or chess, whatever it is, but this is an opportunity also to create some new family traditions. And then of course, last but certainly not least, prayer and meditation. I've included here for you some hotlines because there are times when all of those things and all of your best efforts don't work and you may need support. And so the numbers that you see listed on the screen will make sure that they are available to you. This is the Disaster Distress Helpline, also the National Domestic Violence Hotline, and then the Suicide Prevention Hotline. If you don't want to call the Disaster Distress Helpline, you can text Talk With Us to 66746. That's 66746, and you text Talk With Us. One other treat I'm going to share with you guys before we open up the line and take some questions is there is a really amazing online course that Yale offers, and it's called The Science of Wellbeing. Now, this class is absolutely amazing. They've offered it for free right now, and over 600,000 people have taken this free class from Yale. So I wanted to make this available to you all if you had not heard about it to date. It is called, again, The Science of Wellbeing, offered by Yale University, and we'll make sure that you have this resource available. I've also pulled together a list of other resources for you, whether it is for children, for your kids, whether it's reading, food pantries, mental health, up-to-date information on COVID-19. We've made all of that available for you. And so again, we'll make these links available, but make sure that you're tending to your mental health while you're at home. So I'll stop there because we want to spend some time with you all answering questions. So thank you.
Thank you so much, Joy White. It was really valuable information. Stress is definitely on the rise, and you shared how to manage your anxiety, and that is okay, and you have resources. So everyone, I hope you noted down the number, and please note that we will be recording this and posting it on our website, so you can always come back to it and watch it later as well. Now I'm going to introduce the president of ICOI, Sadaf Aga, and she will have a few words to share with us and introduce our special guest here tonight. Sadaf, on to you.
Hello, everyone. Thank you so much for joining us. I wanted to thank you, all of you, whoever has joined, all the panelists, and our Imam, Star, Munazza, Brother Amin, all the volunteers behind this panel, and especially Congresswoman Katie Porter and all the doctors who have taken out time to answer our concerns, besides helping on the floor of the Congress and floor of the hospital as well. Now, I had hoped that we were meeting in a different setting, but you know, I pray and look forward to meeting all of you in person, and I hope everybody's benefiting from this panel. In order for us to be able to continue and bring this kind of programs and to continue to serve the community's spiritual well-being, especially during these testing times, I want to share our donation link to you to donate to ICOI so we can do more and more and be able to serve the community. It's icoi.kindful.com. Now, it gives me great joy and honor to talk about our Congresswoman Katie Porter. She represents the 45th Congressional District. Putting Orange County families first, she doesn't shy away from asking tough questions from the big CEO and hold them accountable. As a single mom, knowing the challenges of working families, she has introduced bipartisan legislation to allow families to set aside more pre-tax income for dependent care. And she has recently led charge in securing the free testing for coronavirus and is using her background as a consumer protection expert to be an advocate for Orange County families during this crisis. Now, please join me in welcoming Congresswoman Katie Porter. Thank you.
And thank you very much. Thank you everyone for having me tonight. I'm delighted to be here. It brought a big smile to my face to see you, Sadaf. It's wonderful to be connected with you and with the community. Thank you all for your hard work. Our centers of worship, our centers of faith are incredibly important at this kind of trying time. They're one of the tried and true trusted ways that we come together to care for each other. So thank you for putting this on. I just wanted to give a quick update for everybody about the bill that was was voted on, the new law that was signed by the president tonight, because there's some important things in there for you to know about, and our office will be working to get you more resources in the upcoming days. One of the most important things this bill does is it provides $100 billion in national funding to healthcare providers and hospitals. So these are the frontline entities, places like Hope, places like Chalk, places in our community that are having to make tremendous expenditures right now to try to get ready to help the patient inflow. It also provides additional funding to FEMA. FEMA is now managing the coronavirus task force at the federal level. So it provides some money for that. And then it provides money to a state and local stabilization fund. So this is going to be very helpful in giving money to our localities and to the state of California during this crisis. I know a lot of you are small business owners, or you have family or friends who are small business owners. So I want to talk about what's coming there. Very good news. There was, I think it was $325 billion put into the Small Business Administration for grants as well as disaster loans. And so the way this works is, even if you've had to let people go in the last week or two, you're still eligible to apply for these grants. You can put these people back on payroll and use this money to continue keeping your small business afloat during this time. So our office will be hosting a special resource seminar, virtual, online, for small business owners. But the bill was just signed into law a few hours ago by President Trump, but my staff is already working very hard to get those resources together for you. So if you are a small business owner, please, I know how hard it is, try to hang on, try to have faith. We are working very hard to get help to you, and we'll be partnering with the Small Business Administration Center in Irvine so that they'll be a partner in getting you this information. Third thing I want to talk about is, if you have, for families, if you have lost your job already, please apply for unemployment benefits. Please don't be proud. You need this help right now. The bill that we passed out of the House, the bill that the president signed into law, provides for an extra $600 per week in unemployment benefits. So reach out and apply for those unemployment benefits. It also provides for cash payments to American families and children. And the way these cash payments are going to work is that they are up to $1,200 per adult and up to $500 per child. Now, that's the good news. The bad news is that those payments start to phase out. So for a married couple, if your adjusted gross income is $150,000 or more, you'll see that phase out of payments. So for high cost of living areas like here in Orange County, some of us will get payments and some of us won't, but the goal is to get the money to the people at the lower end of the income spectrum. You don't have to apply for these payments. Please do not be scammed. I am so disappointed and furious to see people trying to scam people during this pandemic. The checks will be sent to you automatically. The IRS is going to use your tax information on file, looking back at what your income was in 2018 or 2019 if you've already filed your taxes, and then those checks will come to you. They'll come to you actually not as a check, but as a direct deposit if that information is on file with the IRS. So they estimate that they're going to be able to get a significant amount of this money out in the next 2 to 3 to 4 weeks. I wish it were faster. I know the first of the month is a stressful time. It certainly is for me trying to pay my bills, and I know it is for a lot of you. So those are some of the good things that are in this bill that I'm excited about. The bill falls short in some key areas, and I want to be straight with you about what they are, about what more needs to be done to help our community and to help people across the country. First, and this is very, very difficult, the bill does not provide for help in paying for the treatment of coronavirus, which particularly if you are one of the people who fall very sick and you're required to be in the intensive care unit, can be very expensive. So while testing is free, that was accomplished a couple of weeks ago with the bill that we passed, the back and forth I had with the director of the CDC pressing him on free testing. Treatment There's still no government cost sharing for treatment. So if you have a high deductible plan, if you don't have health insurance, there's no help with treatment. We are working on this. House Democrats know this is a problem. We know that some people won't go get tested because even if the testing is covered, they're scared that they won't be able to afford the treatment. So that's a big area that we're working to improve. Second big area that I want to see improvement in, and I'm pushing hard for, is we need the administration to direct OSHA to issue an emergency guidance regulation on how to protect not just healthcare workers, doctors and nurses, but also people who work in hospitals and other capacities, people who maybe prepare food in a hospital, people who are janitors or receptionists in hospitals or clinics. We also need to make sure we're protecting our other first responders, EMTs, police, fire, and even folks that are working in grocery stores, pharmacies. All of these people are at increased risk right now, transportation workers. So we need OSHA to make clear what companies need to do to protect workers who are needed to stay, who are essential that they stay on the job during this pandemic. The last thing I want to identify is the oversight in this bill. So the bill creates a $500 billion fund at the Treasury called the Emergency Stabilization Fund. That $500 billion, the intent of it is to help companies and industries that have been really hurt to stabilize. This money is going to go to the largest corporations in the United States, many of whom just finished huge stock buyback programs, dividend programs. They didn't save up for this kind of an incident or this kind of event. So we need to make sure that that $500 billion is being spent. If it's being given to United Airlines, that what they're doing is they're keeping workers on payroll during this hard time. And so what we've already seen, even today, the bill was just signed hours ago, we've already seen United Airlines say, thank you, we'll take the money. And we understand as a condition of the money, we have to keep workers on payroll till September 30th. Great, you're fired on September 30th. We just want to give you notice today. That is an outrage. An absolute outrage. So we need to make sure that this oversight panel that Congress is going to establish is going to be equipped with people who are ready to start working tomorrow morning. It needs to get up and running fast, and we need to put people who are willing to fight for American families and fight for a fair economy. I want to be clear, I know businesses need help. I don't think anybody is arguing that our big corporations have been hurt just like small business has been hurt. But we need to make sure there's a level playing field between small and big business, and that this Treasury fund doesn't turn into a slush fund that Secretary Mnuchin has sole responsibility over. We need to have a checks and balances system of oversight. So that was a lot of information. This is an 800+ page bill. It won't surprise you that there's a lot of parts of it that I didn't touch on. So I just want to close by mentioning two final things. One is, if you're not following what the governor has been doing, please do. Governor Newsom has been doing a terrific job in trying to help families. Today, he issued a very important order that pertains to evictions. So if you're a renter and you're unable to pay your rent this month because you've lost your job, there is help available, temporary help, but still some help, some time. Same thing with mortgage payments. He's gotten a deal with the big banks. If you reach out to them and tell them you can't pay your mortgage because you've been laid off or had your hours go down, your salary go down because of coronavirus, they're gonna be able to give you help. So please check into what the governor's done as well. And we'll be assembling those state resources as well as the federal resources. So we hope to have a town hall, like I mentioned, for small business. We hope to also have one that's focused on individuals, on what families can be expecting. I just want to close by saying a little bit about my own experience in the last week. I came home from Washington 2 weeks ago tomorrow. I was so happy to be home and to see my children. They were scared. I was scared for them. It was important that I be with them. But a few days after coming home, I got sick. And I was sneezing and I had a runny nose. I didn't feel good. Most of you know I have a lot of energy. So for me to go to bed at 6 o'clock is not a good sign. I did that for a couple days. And then I did exactly what the public health officials tell us to do. I stayed home the second I felt sick. I called my healthcare provider. I described my symptoms, and they told me what to do. Take my temperature, write it down, stay hydrated, stay in bed, get rest. Call back if things got worse. I called back when I got a fever of 108 that wouldn't go down. I went in and I got a test, and I had to wait 3 or 4 days to get my test result back, and that was hard. But I want to tell you, one, not every sniffle or sneeze is coronavirus. I'm feeling so much better. My test result was negative. And whether that was a false negative or not, the important thing is that I'm feeling better. And what I'm really feeling good about is during that entire week, I stayed in this room, in my bedroom where I'm standing here filming this, away from my children, away from my community, but making sure that I was protecting my children and protecting my community from getting sick. That was a long, hard week, but it was the right thing to do. So please, I know that a lot of you are worried about not being able to get a test. There are way too few tests, especially here in California. We are really behind some of the other spots in the nation, and I know that. But I also want to remind you that if you're sick, what to do. Stay home, call your doctor, follow their instructions. A lot of people will get better, and a lot of us, if we stay home and stay safe, God willing, won't get sick at all. So please take care of yourself, take care of your community, and I'm delighted to answer any questions if we have time, but thank you for allowing me to be part of your community and part of your conversation this evening.
Thank you so much. Thank you so much, Congresswoman. I'm so glad. It's a big relief to hear the news. And we were praying for you. And I'll open up the floor. I'll have Munazar ask the questions.
Okay. Thank you so much. Thank you so much, Congresswoman Katie Porter, for giving us these important updates. And it is our absolute pleasure to have you here join us in our efforts to raise awareness. So we do have some questions here. Does CalOptima cover treatment for coronavirus?
Yep. So good question. So CalOptima, Medi-Cal will cover, coronavirus isn't special. So in other words, if you had healthcare coverage, coronavirus isn't going to be treated any differently. So for example, if you have Medi-Cal benefits through CalOptima, if you got the regular flu or you got pneumonia, you would be covered through CalOptima. It's going to be the same thing for coronavirus. Okay, so it's not any special treatment, but what we're worried about in this situation, we're always worried. I mean, at least I am always worried about people who don't have insurance or whose insurance is really expensive, that they might go without care. And we know that every year in this country, about 1 in 4 Americans goes without getting care for a serious medical condition because of the costs. Some of those people don't have insurance. Some of them have insurance, but the out-of-pocket deductible before the insurance kicks in might be $500 or $1,000 or $2,000 or more dollars, and people may not have that money. So yes, coronavirus is covered by CalOptima, just like any other illness is covered by CalOptima. But what we're trying to do is make sure that regardless of the kind or type of insurance that someone has, that the cost sharing part of the insurance doesn't discourage people from going in to get treatment for coronavirus.
All right. Thank you so much. That was very valuable. Let me see if we have any more questions.
Can I ask a question?
Sure.
Congresswoman, how can we push for that, the emergency guidance regulation that you mentioned?
Oh, for the OSHA workers, for OSHA to issue this worker protection? Yes, so we tried to get it into the bill that was just passed today, this morning. We tried to get it into the bill and we were not able to. It's incredibly disappointing to me as a person that Democrats and Republicans couldn't come together and agree on this. Democrats were pushing for this, Republicans were not. It's really wrong to expose workers who are risking their lives to stay on the job to this virus, and business needs to be stepping up and providing appropriate protective equipment. But to do that, business needs to know what are the right kinds of protective equipment to use for different kinds of workers. And so this is something, I want to be very clear about this. This is a power that the Trump administration has right now. OSHA could issue this regulation immediately. What we tried to do in Congress was force OSHA to take this action. And we weren't able to do it. So I think it's really important that people publicly speak up about this. I know I've been concerned when I went into the doctor myself here in our community. When I walked in the front door, they said I'd be given be stopped and I'd be given a mask. And I walked and I didn't walk close to the people. I said, I'm here to be tested. I need a mask. They gave me one, but the workers sitting at that table were not wearing masks themselves. Right? And so while the doctors and the nurses had masks on, the folks that did the check-in at the front desk at the hospital did not. So those are some of the kinds of workers that we're worried about right now, is trying to make sure our grocery store employees, when they're ringing you up, they probably need to have N95 respirator masks. They're going to see a lot of people through that checkout line every day. And a lot of those workers are lowest income, most vulnerable workers. And so we need to make sure that they're not putting their lives at risk and we can protect them. So I encourage you to speak up, to call the White House, to push for this regulation. It's something the White House could do, the administration could do today.
Sister Manazza, if you have any question, or can I go with one more?
Yes, yeah, you can go ahead. I'm looking at the chat and looks like we don't have any more questions for the Congresswoman, but go ahead, Sita.
So Congresswoman, as a community, interfaith and of all faiths, how can we be of help during this, besides taking care of the community who are in need spiritually and financially? How can we help you get the legislations approved? What can we do if you can guide us?
No, I think you can call the White House. You can make your voices heard as citizens. You can reach out to the County Board of Supervisors if there are things that are not happening at the county level. If there are things that are not happening at the state level, reach out to your state legislators. But I think we're very fortunate here in California to have a good partner with our governor. I know the governor here in California took strong and early action. But I think when you look at how we're faring in California, we are seeing so many fewer deaths than our colleagues and our fellow citizens in New York. And so it's really important that we continue to listen to him. But reach out if you have questions. If you're seeing things in the community that you think I need to be aware of, don't hesitate to call my office. My staff is all working remotely, but I don't know that I've ever worked harder than I've worked this last couple of weeks here because really lives are at stake, and I know that. So I think most importantly, as you said, continue to care for each other, continue to be safe, and continue the work that I've seen you do over the 2 or 3 years that I've gotten to work with your community of making contributions to food banks. If you're healthy and not at any risk, that is if you're a younger person with no underlying health conditions, consider donating blood. There's a very, very short supply of blood right now because all of the normal blood drives that occur at universities and at workplaces, they've all been canceled. So the Red Cross does have procedures in place to protect people. So that's something else that you can consider doing, or volunteering at a food bank. I've worked with you guys at the food banks before. I know you're very active with that. But if you're able to do those kinds of things, continue to do them in this time.
Thank you so much. Thank you so much for your time, and you have a wonderful team. Lauren and everybody, Christy and everybody had been very, very patient with us, especially me, with all the questions.
Absolutely. I just want to remind everybody again in closing, I see some of the comments popping up here on on my device. You know, it's true that no test is perfect. We've heard a lot, I've asked a lot about this at the briefings. Long before I personally didn't feel good, I was really interested in understanding the science, and we are still learning about this virus. There could be false negatives. So even though my test is negative, I am not going out in public for the next several days because I really did have that fever. I really didn't feel good, even if it's not COVID-19. I don't want anyone to feel lousy. So I think one of the best pieces of advice that we've heard been given is if you're not feeling well, assume it's coronavirus and use all of the protections that you can during this period. So please, everyone, stay safe out there. And it's just an honor to get to be with you tonight remotely. And I look forward to the day that I can join you again in person, that we can come together in person as a community.
Amen. Amen. Thank you so much, Kitty. Thank you so much, Congresswoman.
Thank you.
Thank you.
I'm going to say good night now. Thank you.
Thank you so much. We'll be praying for you and with you. Thank you so much. Appreciate it. Now I'll pass it over to Muneza. I'll pass it over to Muneza.
Thank you. Thank you, Congresswoman. That was very helpful. And thank you so much for all you do. All right. So we will go on into the questions that some people asked for our physicians here. So I have this question for Dr. Huma. As a parent with 2 children with sickle cell disease, how will my children care rank in assessment? My adult son doesn't have a spleen, so he's high-risk person to get affected. Would you immediately isolate him? He's currently having sickle cell crisis, but afraid to go to hospital because he's afraid he might catch disease and die. Dr. Huma Khan, is for you.
Hi, sorry. So what I understood was your children have sickle cell disease. It depends on if they're on any immunocompromised medications. Yeah, they don't have a spleen, so they are a bit more vulnerable. If they are having any respiratory symptoms, you need to call your doctor, preferably the hematologist, and ask them whether they should be tested. If they are having lower respiratory symptoms and they have a fever, I would definitely recommend testing them because they are at higher risk. But again, this has to be run by your pediatrician or hematologist. And if you don't want to bring them into the hospital, a lot of primary cares do have the testing. And if they don't, there are drive-up testing centers available, and you can call the public health department at 211 to find out where those are.
Okay. Thank you so much, Huma. I hope this answers your question. So we have another question here, that what is the reason this virus is increasing day by day? Anybody who's willing to take that one?
I can take that one.
Okay,
this
sure.
is Sahir. So there's 2 reasons why. One is that we are actually testing more people. So of course we're catching more cases that way. The other is this virus is spreading. And I mean, it spreads exponentially. So, you know, it's probably too late to stop it. We want to slow it down. But, you know, to some extent, the number of people with the virus is increasing, and the number of those people that we're detecting is also increasing.
Perfect. Thank you so much, Dr. Sahir Khan. Another question is, how does this virus compare to Ebola, and why has it been so much more threatening here in the US than Ebola was? Anyone?
I could probably take that one as well. So, you know, Ebola is not really spread by respiratory droplets. It's so even though it may be more contagious and more deadly, because this one is spread by respiratory droplets, and the other thing is coronavirus can be spread prior to development of symptoms by a day or two, so, or prior to development of severe symptoms. So those are 2 reasons why we were unable to contain this particular virus.
Perfect. Thank you so much, Dr. Sahir.
Can I also just add that I know the media is saying that we should fear this. It is very serious disease, but do remember that the majority of cases will be mild. And that's another reason why this is spreading. It's because a lot of people initially thought they just had colds, and so they weren't isolating, and it is very infectious.
Perfect. Thank you so much, Dr. Huma. Another question we have is that how helpful are cloth masks? I have seen volunteer opportunities to sew them and donate to hospitals. Will they be effective?
Sorry, go ahead. I can just say that in the ER, they are completely not effective. They're completely ineffective. But as a normal walk outside or going to the grocery store, I believe they're probably just fine.
Yeah, so I'll just say that masks for medical use have to meet certain standards to actually prevent the small respiratory droplets that spread the virus from getting through them. And I imagine most masks that are home sewn, it would be difficult for them to meet those standards. Each hospital has, their purchasing department will have strict criteria sort of on which masks actually work medically. But, I think someone asked on the chat about bandanas and stuff. Sometimes covering your mouth with something like that, particularly if you're sick, can actually be very helpful in the community.
Perfect. Thank you so much, Dr. Sahir. One of the questions that we got is that once you have the disease, do you really acquire immunity, and does COVID-19 fall into this?
So I can probably answer that. I actually do research on this topic. It's likely that you will be immune to this particular strain of the virus once you have recovered. Now, this virus could mutate in the future the way flu mutates every year, so that even if you get the flu one year, you can still get the flu the next year. The same thing could happen with this virus, but indicators are that even if that happens, if it comes back, say next year, it's probably not going to be as severe because people will have partial immunity. And this virus also doesn't mutate as quickly as the flu, so it may not come back as frequently or as severely as the flu. But that is a risk with this virus, that it'll eventually become a sort of seasonal virus like the flu.
All right. Thank you so much, Dr. Sahir. I think Joy will take over some questions from the audience from him.
Yes. One of the questions that came in from Rahima is, where do you go for tests? So if you all can respond back to where they go for tests, we've given that information, but in giving so much information, where do they go for tests? I'll let one of the physicians answer that question.
So I can just say that we recommend to call your doctor and have them order a test. As of now, there aren't really places in the community that are just having people walk up and get tested. We want you to have a doctor's recommendation to be tested because testing capacity is still limited. Now that capacity is increasing. So in the future, there may be more availability for sort of walk-up testing centers where you can be screened for symptoms and tested right away. As of now, it's still usually with a doctor's order. I know UCI in particular, where I work, has on-site testing, but we reserve it for now to sort of sicker patients who need to be hospitalized. But I think fairly soon that capacity will increase to the point where we're able to offer more to the community.
Thank you so much. Next question. Are all states participating in some type of lockdown? I would answer this question by simply stating, depending on the state that you are in, I would recommend that you look at that particular state's guidance regarding the coronavirus, because even within the state of California, there are different guidelines based on certain counties. So I would say look at your local resource to determine what those requirements and guidelines are. Next question, and I'll direct this to one of our physicians. If you are disinfecting and wearing gloves, is that the best thing that you can do? Actually, Dr. Khan, you answered that. The question was, if you go to the grocery store, can you go without wearing a mask and just keeping social distancing? So do you want to add to that answer, Dr. Khan, at all? So going to the grocery store, to the gas station, to the bank, to any of those places, what should we be doing?
At this point, I actually would recommend some sort of a mask as well as gloves. And remember, even though you have gloves on, if you're touching the gloves to your mask, there's still a possibility that droplet could still get in, the virus could still get in. So make sure after you're touching things, you're not touching your face or your mask, and you're disinfecting with sanitizer before and after you get in and out of the car and into your house.
I would just add to that. I think this is a place where maybe a homemade mask or something is a little more appropriate, because what I would encourage people not to do is try to go buy medical grade masks, because we have a limited supply and we really need to reserve those for our healthcare workers in this country. So if it's a homemade mask or bandana or something, I think that's appropriate. But I would sort of disencourage people from trying to go to the pharmacy and buy up all the medical supply masks. I mean, it's probably hard to find them nowadays anyways, but.
Agree. Thank you, Dr. Khan. Last question that I see in the chat right now. Well, there's another one just came in. Does ethnicity affect the rate of infection? So in other words, do genes play a role, DNA play a role? Are we seeing any particular ethnicity more affected?
So I'll just say genes almost certainly play a role. We know that there's genetic predisposition to almost any infectious disease, but there isn't, as far as I've seen in the evidence, a particular ethnic, we know that socioeconomically disadvantaged minorities will do worse outcomes for this, like almost anything in our healthcare system, just because of access to care. But, strictly in terms of an ethnic predisposition of the virus, I don't think there's no evidence that the virus knows, kind of what ethnic background, and it behaves very differently.
Thank you. So
Can
someone said in the chat, it's becoming very confusing.
Yeah, I was just going to address that.
Okay, yeah. So they're saying it's very confusing. You're telling us to stay inside, but also saying that it's good to go outside and enjoy nature. So if we can put some parameters around that. What I'll suggest, and please add to that other panelist, it is okay to take a walk. Social distancing, maintaining that 6-foot distance is still really, really important. But we do encourage you to go out for walks within your neighborhood, not out on the beach, hanging out all day around a ton of folks. But we certainly do encourage walks within your neighborhood, but again, maintaining social distancing. So I'll open it up for other panelists to add to that answer.
Right. Let me just add that if you are coughing or you have congestion, please don't go out. And if you especially have a fever, don't go out. Don't go grocery shopping. Designate someone else to go grocery shopping for you. If you're unable to, please do online grocery shopping. And if you have those symptoms, you actually should be isolating yourself in a room away from your family as well with a mask. But please don't go out even for a walk if you have any of those symptoms.
Yeah, I would second.
Go ahead.
I would second what Dr. Khan said. I think, when people say things like, okay, go out for a walk, go out in nature, I think that's just acknowledging that, human beings, we weren't evolved to sort of be cooped up in home all day, and there are mental health issues related to that. So, just to be realistic here, I think when people make those recommendations, they're just trying to acknowledge that everyone's human, and, it's very difficult for us right now. But I would definitely second what Dr. Khan said, especially if you have any symptoms, do not go out because you could infect others.
And I would also add to that doesn't mean going to playgrounds, because I know we all have young children. I do too. And there's a lot of germs. Oh, there's one of my little ones right behind me. 1 second, sweetie. So there's a lot of germs on those playground equipment. So please don't go to the playgrounds, just a walk or maybe your bike, and stay your distance from other people.
There's another question that just came in, and we're drawing to the close, so this will be the last question unless I hear otherwise. We hear in the news that there's some patients who are recovering, but at the same time, they're saying that there's no cure. So can you kind of explain the recovering and no cure? Just give us some clarity there.
Yeah, so most people who get this virus, it'll be like the cold. Like you get infected, your body fights it off, and you get better, and you're recovered. I would say, you know, probably upwards of like 90% of people who get this. Now, a small percentage of people where, you know, the virus becomes more severe, it goes to the lungs, you get a pneumonia, you need to be hospitalized. And then a small percentage of those people, unfortunately, will succumb to the virus. Their body won't be able to fight it off. But the vast majority of people who get this, it'll be a cold, your body will fight it off, you will recover. You know, you have an immune system that has been fighting viruses long before we had medicines.
Okay. Thank you so much, Dr. Sahir. There is one more question I think is important, just one last one, is that any tips on women who are expecting or expecting to be delivered soon? Are fathers allowed in the delivery room? How to protect them during in that environment?
So UCI has a strict no visitor policy right now to try to avoid spreading the virus in the hospital, but we do make an exception for fathers in the delivery room. So I think that's acknowledging, you know, that's sort of one of the very few exceptions we have to that strict policy.
Okay, that must be a relief for a lot of women. Thank you so much, Dr. Sahir, to answer that. Dr. Huma, do you want to add to that? Like if anyone ends up in ER being pregnant and soon to be delivered?
I'm sorry, can you repeat the question? I was just answering some of the questions on the panel.
Sure, no problem.
Discussion?
So some tips on women expecting to deliver, or what if they have to show up in ER?
If they have to come to the ER if they're having symptoms? Was that the question?
Yes.
Symptoms of respiratory symptoms?
Right, exactly, related to COVID and stuff. And you know how they get stressful because they're not sure if it's that. So what are your take on that?
I think that in pregnancy, you do tend to be more immunocompromised, but at the same time, it's the same recommendations. If you have a fever and if you're having difficulty breathing, you should definitely come to the emergency room. If you're even just having difficulty breathing with a cough, you should come to the emergency room. But if it's just a low-grade fever with no other symptoms or just a cough with no other symptoms, you can stay home and just have supportive care, fluids, cough medications, things like that.
Okay. Thank you so much, Dr. Huma. And everyone, this will be posted on www.icoi.net. So, and any questions that were unanswered, we'll try to come back to it. We'll probably post an article on it for you so that all of your answers will be, all of your questions will be answered later. So now I would like to request our respected Imam Sheikh Atif to please take over and make a dua for us. Welcome, Sheikh Atif.
Thank you so much. First of all, I would like to thank everybody, all the speakers. Thank you so much for your time. We really appreciate what you shared with us, you know, appreciate your time and the knowledge that you shared with us. May God bless you and bless your families for all that you do. And may Allah subhanahu wa ta'ala protect our community and bless our families. Allahumma ameen. All right, let's pray. In the name of Allah, the most merciful, the ever merciful, all praises are to you. You are the holder of the heavens and the earth and whatsoever in them and between them. All praises for you. You have the possession of the heavens and the earth and whatsoever in between. All praises are for you. You are the light of the heavens and the earth. All praises are for you. You are the truth. Your promise is the truth. And to meet you is true. Your word is true. Paradise is true. Prophets are true. Moses is true. Jesus is true. Muhammad is true. And the day of judgment is true. We ask you to bless our country. We ask you to bless our town and protect the communities of our town. We ask you to bring an end to this pandemic very soon. We ask you to remove the anxiety and the depression and stress that people are going through. We ask you to have mercy on us and to pardon us and to forgive us and have mercy on us. Amen. Thank you.
Amen. Thank you so much, Sheikh Atif. That was beautiful. And we do pray that we come out of this calamity safely and with health, and may Allah stay with all of us. And I would just like to conclude today's webinar. Thank you so much, everyone, for joining us. We hope that we were able to bring some clarity to you on what to expect from this pandemic and how to stay safe and healthy during these tough times. And a special thanks to our resources from Allah, our amazing healthcare professionals working on front lines, risking their lives so they can save ours. Thank you so much, everyone. Dr. Sahir Khan, thank you so much. Dr. Taliha Yasin, thank you so much. Dr. Huma Khan, thank you so much. And Joy White, thank you so much. Everything we have here today, all the questions that were unanswered, please remember to visit our website, and we will be posting those over there. And thank you once again for joining us. Have a great night.
مولاي صل وسلم دائما أبدا على حبيبك خير الخلق.